We will give it a couple more seconds and then we will get started. Okay, so what we got from I will share the results just so you guys can all see. You guys are from mainly counselors and stuff from community mental health centers and other places. We would like to take a minute to recognize that this series is funded by HRSA as well as the Aberdeen Area Community Foundation. So without any further ado, I would like to introduce our next speaker, Polly Roberts, and she will start the presentation. So thank you.
Thank you so much for that introduction. I am very excited to be here today to discuss one of my favorite topics, which is telehealth. And it has been an innovative solution for individuals to receive access to care, especially when we're discussing mental and behavioral health services. I'm from a rural area rural state, I should say, in Nebraska. So we have always seen the importance of ensuring that individuals have access to much needed behavioral and mental health services. One of the things that I think is important to know is that I'm a psychologist, so I do practice and I am engaged in 2 days a week in therapy with assessment and treatment. And not only do I enjoy training in telehealth, I also utilize it quite a bit too. So there have been things that we talk about that are lessons learned, and then there are things that I like to talk about that are just good things to think about. So sometimes it's helpful when we're going through all of this material to not have to look back and forth between my face and the presentation itself. So if it's okay with everybody, I'll just stop my video and then I will come back when we're answering questions, if that works for everyone. So let's see. This will show you if I have some telehealth knowledge here, if I can get all of this to work. So I will introduce our center. We're from the MHTTC network, and I have to provide this disclaimer that we put this together for a grant that we received from SAMHSA, and in no way, shape, or form is there does this express the views of our Department of Health and Human Services or SAMHSA itself, but that is our funding source. At the end of today, what we will ask is that you complete a brief evaluation. Because our event is federally funded, we're required to ask for satisfaction with our services, and to maintain our funding, we're required to get 80% follow-up. So we would greatly appreciate any feedback that you could have. Michaela said she would send out the survey following today's presentation. So I want to start with what is the Mid-America MHTTC, because I want to look at today as a starting point, and a starting point for receiving any technical assistance with telehealth or even integrated care. So the Mid-America MHTTC is funded by the Substance Abuse and Mental Health Services Administration. And it's a 5-year grant for $5.2 million. It was awarded to our mentor, Dr. Joe Evans, who pioneered integrated care in the state of Nebraska. And we have our charge is really to align mental health services and competencies, and our focus is on school-based mental health and also in integrated primary care settings. So our goal is to really provide free and low-cost training and technical assistance on a variety of topics related to mental health services. This gives you an idea of a map. I think we're all very close to one another. We're just a couple of states away. We are right in the middle of the U.S., and it is helpful to know that there are other MHTTCs and other TTCs around the country that also provide technical assistance and training in a variety of different areas as well. Along with our MHTTC, we have our website. We welcome you to come explore our website. It really has a lot of events and training in particular in different areas. Right now, we have started a webinar series on coming home to primary care and issues related to the primary care experience. So those are every last Friday of the month from 12 to 1. Some other services, some just basic services that we have, we look at universal areas. So we really want to target conferences and presentations and that sort of thing. We also have more targeted focus on online courses, webinar series, focused on individual consultation with organizations on implementation of integrated care or implementation of school-based mental health, and also implementation of telehealth services as well. So here are some of the areas that I discussed that we specialize in: integrated behavioral health, school mental health, serious mental illness, and then just behavioral workforce development. We realize that in a predominantly rural state that we're often not able to keep people in the state once they're done with their training. So our charge has always been to try to attract and retain individuals in our state. Let's see. And like I said, we're very much involved with integrated behavioral health care and have over 20 years of experience integrating behavioral health into primary care and over 40 different practices across Nebraska. And part of that integration involved the utilization of telehealth. Living in a rural area, we understand the value of increasing our reach to those who are in frontier areas. So the rural of the rural, it's really important that we're reaching out to those who are in areas where even though a primary care access point is there, that there's still maybe several hundred miles between them and their mental health services. So this gives you a little bit of an idea, a summary of what I've discussed, and we'll make these slides available to you at the end too. So I wanted to start with some interesting fun facts. As you may be aware, living in a rural state in North Dakota, that 20% of the US population does reside in a rural area. And I would say that Nebraska and North Dakota probably make up a big section of that. Most of the US population, including behavioral health providers, were basically considered rural beginning in March of 2020. So, and what I mean by that, I'm sharing this because with a little bit of sarcasm, but we all basically became rural providers. We were at a distance from our participants. And so it is really important to think about that distance. Even if it was across the street, we were still very distant and not able to communicate with patients or be in a face-to-face session with them. Telehealth has actually been used since the 1950s. It wasn't widely used, and most of the reasons why it hasn't, it didn't gain any footing was because that there wasn't a revenue stream for it back then. It was rather expensive, and it wasn't reimbursed. Those services weren't reimbursable, so it wasn't utilized to the extent that it could have been. Another fun fact here is that older adults are satisfied with telehealth. In one study, and I picked out one study, but there are several studies that indicate that older adults, those that we think that aren't really interested or don't feel like they can utilize the technology as easy, gave it a 3.4 out of 4, with 4 being very satisfied. So there is some support out there for using it with not only our younger population, but also our aging population as well. And then just overall, telehealth has a lot of research support pre-COVID. I know we did a very rapid shift when COVID-19 hit, but there's a lot of research support prior to that time. So I want to talk about what is telehealth, and I want to breeze through this really quick because I like to get to the lessons learned and the meat of this content pretty quickly. But telehealth is an overall word. It doesn't mean one thing, but it is often defined very differently among various organizations. So telehealth in a lot of ways is health. It is delivered via video and or audio connection, and it really is about the transmission of images, voice, data between two health units or two individuals for the purpose of healthcare. So it's really a broad term that applies to healthcare. Now, there is a legal part of what is telehealth in everyone's state, and I will refer you to the resources in your state to get an understanding of how they define telehealth. For instance, pre-COVID, telehealth was defined as the same as in-person care in the state of Nebraska. However, telephonic was not allowed in Nebraska pre-COVID, as it is now that restrictions have loosened. So I expect that there will be some changes. They may go back to where they were, where it needed an audio-video connection. But we always look at telehealth as to how it's defined and the way that we may use it. So it's a very broad term. It could mean live video synchronous. It could mean that it is asynchronous, and it's just more of an area of storage and communication back and forth between providers. But when you hear the words telemental health, then it's the use of telehealth as it relates to psychology, counseling. Some people say behavioral health or mental health. It kind of depends in the field or even the population that you serve. But you'll often hear me go back and forth between telemental health and telehealth. I tend to use the word telehealth quite a bit, but I will be referring to it as it relates to the delivery of mental or behavioral health services. So part of the reason that there are differences in the definition is because there's a lot of ways that telehealth is used. And I have to pause and say that my presentation today is very much focused on live synchronous telehealth, where we're seeing, we're in one spot and we're seeing a patient in another spot. So either in a clinic or at their home. So it is that live synchronous interaction. But there are a variety of other ways that you can utilize telehealth as well. And it kind of comes down to, is it reimbursed? Is it for consultation or direct clinic care? Is it for remote monitoring? So we'll get into some of those things as well. Some key questions that we often think about when we think about telehealth is that, and when you're trying to think about what does telehealth mean for me providing this service or for my organization providing the service. So you really have to answer some of these questions. Who's providing the service? Who's receiving it? Is it a clinical service? Are you doing assessment and treatment? Are you doing therapy? Is it a professional consultation? That is a very popular form of increased access to care, is to be able to consult with let's say, a psychiatrist on a case versus sending the patient to the psychiatrist. Maybe there's a way that we can consult and provide some of that care in this, at one time through consultation. Is it for education or training? How is this service funded? Are you part of a collaborative care organization where where that team structure isn't necessarily mean that you as the behavioral health provider are billing for those services, or are you billing individually for those services that you're providing? And what type of technology is going to be used? Are you thinking about audio, video, audio only? Those are things that can certainly be answered by your state laws first, and then also by insurance companies. Luckily, insurance companies very much lightened up and relaxed their requirements, as have states. But again, it's very important to check your state laws and regulations, because as we move through this pandemic, I can definitely see some changes that are occurring. And later in this presentation, I'll give you some resources as to where you can check daily what those regulations are in your state. So I touched on this earlier. The service is provided via telehealth. I'm going to focus on that live video conferencing, telephonic synchronous method, where it's provider to patient, utilizing family therapy, individual therapy, the things that we would do in session, but using it on a web-based platform with audio and video. But keep in mind that there are other types of telehealth technologies, such as store and forward, remote patient monitoring, and mobile health. So why telehealth? Well, one reason that I don't have on here is that we are in a pandemic, and we are in many ways, we're not able to see patients face to face because of directed health measures in some areas. But in some ways, it provided everybody that boost to start utilizing something that has been very effective, but creates a lot of anxiety among a lot of people. It is a very efficient way to deliver healthcare. It's effective at meeting patient goals. And this is all based on the research. Let's do in-person delivery of treatment for depression, and let's try that same delivery, but use same intervention, but let's do it via telehealth. And what we've seen is that that telehealth is just as effective in meeting patient goals as it is in person. And patient satisfaction is typically higher than provider satisfaction with thinking about using telehealth. So it is one of those things that your anxiety will really dictate the comfort level of your patients when you're seeing them via telehealth. It also meets that quadruple aim that oftentimes healthcare organizations are aiming for. So in that improved patient experience, better health outcomes, reduced medical costs, improved clinician experience. So used to be the triple aim, now we often see it as the quadruple aim, because clinicians' experience is very important. But oftentimes in an organization, one way you can sell telehealth is the costs that you might reduce, the efficiency in seeing more patients for less amount of money. You're not driving between sites. You're not spending an entire day on the road. If you're in a rural area, you may be able to see more patients that way. And the technology is fairly inexpensive. As time has gone on, we used to have very large Polycom systems, and it filled up my entire car, but we'd load it up and we'd take it to a site and we'd utilize it there. Well, now these systems such as Zoom and other platforms have made it much easier to use, and has reduced those costs of those rather large systems. So we have these benefits. We're increasing access to healthcare. We're reducing costs, which our employers really like. We have research supported outcomes, and patients are actually satisfied with this. Even older adults are fairly satisfied with this, which is, I think, shocking to a lot of us who are not always super comfortable with the thought of technology. Our children are much more technically savvy than we are oftentimes, but the platforms have become a lot easier to use, which is a huge benefit. It's also really allowed us to continue care during a pandemic. And I smile, I know you can't see me right now, but I am smiling at the fact that this did give us that push. If there's anything positive that's coming out of this pandemic, it gave us all that push to at least try a new modality. So I like to say, you know, why telehealth? Why not telehealth? really, it's given us that opportunity to increase access for patients and to provide that same high quality healthcare. When you're thinking about utilizing telehealth, there's some setup involved. I would always encourage everyone to think about the amount of time that you really want to spend setting things up and understanding what is needed. Sometimes we don't have that time. We're just kind of thrown into it. Luckily, the laws and the insurance companies have been very relaxed over those first couple of months with us getting our boots on the ground and feeling really comfortable with coming up with a process and being flexible in billing, flexible in who we're seeing and what state they're in. And like I said, those sorts of things have always been somewhat of a barrier in many states that, you know, if it's not, the legislation doesn't allow for the equivalence of telehealth and in-person visits, then it really doesn't matter to try to provide those services if your revenue is based on, if your livelihood is based on revenue. But then you have to get the insurance companies also to participate. And we've had many that do, but oftentimes there are pretty large companies, and I work in pediatrics, so we didn't run into this as much, but Medicare hadn't caught on to the use of telehealth as quickly as Medicaid had. They allow it for Medicaid. They've allowed it for Medicaid for many years, especially here in the state of Nebraska. But Medicare, I think, is a new development, allowing older adults and those on Medicare to utilize and for providers to get reimbursed for those things. So there's some steps to making sure that we're set up and we're all scrambling around, but we can also help you think about some of these considerations. We want to make sure that we have professional and patient identity information. We're feeling comfortable with the platforms. We're looking at whether that patient is appropriate for telehealth. Most patients are, but there may be a situation where it could be a danger to others to see that patient via telehealth, because we're not certain what the types of safety concerns may not be able to be easily addressed. But for the most part, if we can look at that and briefly do an assessment as to whether a patient is appropriate, it tends to be a very efficient way to provide services. We need informed consent. Right now, there's a loosening of restrictions. You can get verbal consent right now. As time goes on, I believe we're going to go back to having to have written consent. We have to think about the physical environment. We have to look good on camera. We have to look like we're confident and make sure we have everything set up in a way that is appropriate and makes the patient feel like you can engage. And we'll get into more of that soon. We have to find a way then too to communicate and collaborate with our team members, especially when during a pandemic, we may not be going into the office anymore. Seeing some of those that we collaborate with on a regular basis. We have to think about a new way of collaborating, how we're going to manage emergencies. Are there certain medical issues that need to be considered? And what are some referral sources? Some of us are working in an outpatient type of setting, and not every individual is appropriate for that sort of care. So figuring out, are there referrals resources out there for those that are providing higher level of care, maybe through telehealth. And then there are technical considerations. This is where the anxiety starts to increase. Okay, now I'm getting into tech, and tech is just not my thing. This is what I hear a lot of times. It's just like, I'm just anxious about this. What if somebody pops into my screen? What if my internet goes out? What if, a lot of these things do happen, and there are a lot of situations where we just can't help it, that the power goes out or that the internet goes out, but we develop ways of having backup plans for these things. And as I get into this presentation too, we'll talk a little bit more about some of those things to consider when you're in a session. But we want to make sure we have connectivity and privacy. Connectivity can be a huge issue in a rural state because bandwidth and coverage isn't always consistent. So we have to find innovative ways of ensuring that patients have connectivity. And if they don't, can they drive to their local library or to their school and utilize their internet connection and receive that connectivity that may be needed. And then there are these even heavier things from tech, is all this legal stuff. Like, what happens when somebody is popping into somebody else's session? Is it even legal in my state to utilize telehealth? What are those qualifications that you have to have? There isn't a degree that I know of at this point in telehealth. It's one of those practice and learn things, and through some of these presentations and through individual consultation that I'm happy to have with each one of you after this presentation, we can help figure out what are those legal issues, what are those clinical issues that may be relevant to your organization. So all of these things are the things that need to be considered prior to, and why we have some on our MHTTC website. I have some presentations that go further into each one of these things, the part of the setup. As a resource to you, and again, you will have access to this, there are several resources that give you up-to-date information on practice regulations in your state associated with COVID-19, and then also insurance regulations as well. There is a website that actually goes through every single insurance company and what they're covering and what they're not right now. So I want you to have access to that, because that'll give you a little bit of a time. We know that things typically happen month to month with a lot of regulations, a lot of insurance regulations as well, state regulations, insurance. So we know that at a certain point in the month, if this is the way it is, then maybe we have a few more days to set up what happens if we go back to those pre-COVID regulations as well. I want to shift and spend some time talking a little bit about how to keep your patients engaged. So we're assuming at this point that you have set up all of the clinical considerations, all of the technical considerations to have telehealth, all of the legal and insurance concerns are all set up, and now we're ready to provide mental health services via telehealth. And this is really going to speak to your website manner. It's one of my new favorite words, website manner. I thought that was really clever. I wish I could take credit for that. I cannot, but I'm going to utilize it from here on out. But it is really important. With in-person care, we've had many years of experience, oftentimes, of interacting with patients. But to develop your website manner takes that same amount of experience, even as a veteran psychologist or mental health provider. Your website manner, there are different considerations to make. So when we think about telehealth engagement, we really want, our goal is that we are basically providing in-person care just as well, but we're doing it via telehealth. So our goal is to have the session. We're seeing the family, we're seeing the child, we're seeing the individual, because they're coming to us for treatment. They're coming to us for assessment. So we want them to receive what they are coming in for in person. So how do we get to that point where it feels like an in-person visit, or it closely aligns with what the goal we're trying to achieve? So some considerations when from the moment we're scheduling till the moment that they leave, these are very important considerations to make. Keep in mind that all of those considerations for legal and clinical setup and all of that, that's already completed, that we're really looking at how do we make this session run smooth. I can't say enough that we have to plan ahead. Planning, if we don't go into telehealth not at least doing a little bit of planning, and there may be some grumbling that occurs because we have to do a lot of planning because things were working just fine in person, and now we've got to come up with this new plan. And I've had to revise my plan at my own integrated care clinic several times. And the staff there has been fantastic in that, well, what worked last week isn't working this week, or we've lived, we've learned. Just know it's oftentimes a work in progress, like anything, but planning ahead is really going to help. So here are some potential disasters and or things that really happened to me during sessions. So video but no audio. They updated my computer and I didn't have any audio, so they couldn't hear me, but they could see me. Audio but no video. Families were having a hard time getting their videos to work. Patients are driving during the session. For whatever reason, you can't see the patient. Maybe you can see half of their head, or you can only see the parent and you can't see the child. The delivery person comes to your door and rings the doorbell and the dog starts barking right in the middle of a session. Or at times been seeing families that a random person walks through the background of the patient's home. And so there are a lot of things to really think about. And I say potential disasters. Nothing is a disaster, hopefully. We're always informing our patients if this is an emergency that they have a way to contact 911 if needed. But these things happen. And how do we handle these things if they're happening? More than anything, what we really want to emulate is that things do happen in life, and that there is some value in explaining that, you know what, there may be a time where we lose our connection. There may be a time where, you know, I'm at home providing services. You might hear my dog bark. I'm going to do my best to keep those things, but there's a part of every patient that really likes to know that you're a real person too, and that things don't always go perfectly, but that we're all trying to work through not only this pandemic, but utilizing a platform and keeping everyone healthy by staying at home. So just know that I think patients really do appreciate all of this up front, because when we hit a disaster and we're feeling like, we're not doing it perfectly, that's okay. It's okay. So how can we set the stage to try to keep everything as perfect as possible, and think about some lessons learned and some things that could occur? It really starts when scheduling that first appointment, especially when the pandemic hit in mid-March. It was explaining a lot to families about what telehealth is, the equipment that they would need, the apps that they would need to attend it, how they were going to receive their link. We found it really helpful to provide each patient with an FAQ page or a checklist, so that all of this stuff is communicated prior to the appointment, what they need to do, what, you know, if they'll need to download Zoom, how they can turn on their camera, how to turn off their camera, giving them some sort of guidance here too, because if we can look prepared, they can feel prepared as well. If we can act as if we're calm, then they're going to feed off of that as well. If we act anxious, they're definitely going to know that we're anxious about this as well. But so consider developing the FAQ page or even the checklist for yourself as well, because then it'll help you think about something that isn't a daily task for you. That did I do all of this? And I have several checklists at the end of this presentation that you can download and modify for yourself. And what I've found is that there are some great resources out there, but for each organization, you really have to come up with some of your own plan, because you may be using a certain platform for Zoom, like Zoom, or you may be using video, or you may be using DoxyMe, or you might be using a different platform. So you can look at an FAQ or a checklist that I've provided at the end of this presentation, or to utilize to develop your own. So giving this to the patient at the time of scheduling the appointment, and really who that person that may be communicating this information, it could be somebody who's working at your clinic, ensuring that they're feeling comfortable about what they're communicating as well, because oftentimes the clinician themselves isn't the one delivering a lot of these messages. And then even at the time of scheduling, what I like to do is develop a plan of disconnected. That's where I I usually like to gather contact information. If something goes wrong, where can I reach you? Or how should we proceed if our audio video connection is disconnected for some reason, because it does happen. That's at the time of scheduling. It's really helpful just to gather all of that information, provide them with a checklist, a place where they can go read some frequently asked questions and get the answers to those things, and figure out how to download Zoom or DocsMe or whatever it is that they're using. Somewhere between scheduling and prior to the appointment, you want to test your own equipment, and encourage your patient as well to test their equipment. Become familiar with it yourself. Again, if you look calm, they will be calm. If you feel like you understand all of the functions that are involved on your technology, it'll make them feel better as well. So how does it work? Functions that you might use or you might find useful are the share screen app, which is or the share screen function, which is what I'm using right now to share this presentation. The whiteboard, that's often nice when you can help increase interaction. You can play tic-tac-toe on it with your patients. I work with the pediatric population primarily, and parents, and so ways of interacting with children, as I'll speak to in a little bit, may look very different than the ways that you might interact with adults too. So making sure you're comfortable with the functions that you have, and utilizing some of those functions such as share screen and whiteboard and other apps, really cool apps that you can use. You can set up checkers and that sort of thing too. But then also, as a provider, set up some test sessions with colleagues and friends. Send them the link. Make sure that you know how it works. Make sure you know that if you have to let them out of a waiting room, or if you have it set to the patient comes right in when they click the link. So there are different ways of setting up test sessions so you know what will work best for you. And then also providing on this how-to for patients, but this is also for providers more than anything. There are so many resources right now, and this is just an exemplar, Zoom, because I know there are other platforms out there. But Zoom has, for example, very nice tech support. So you can watch a video on how to join a meeting, how to schedule a meeting, how to host a meeting, and how to provide others with co-host abilities. Very simple and easy ways of how to use, how to get the most out of your Zoom and how to utilize it. So this is all back to, if you're feeling comfortable with some basic features of it, then you're going to have much more comfort in those moments where things don't always go well. Video presence checklist. So there are a variety of ways that I've seen patients, providers, meetings, all sorts of things where if we don't have a good video presence, it really makes it difficult at times to feel engaged with the presenter. You're not even seeing me right now, so here I am talking about video presence when you're not seeing me. But perhaps too, this might be a good time to share my video, because what is important is that you feel as though you're not distracting in any way, that your video presence or your website manner makes you almost forget that you're on a video chat. So your clothing is rather neutral. You can see I'm just wearing navy blue today, or wearing neutral or solid. There's not a lot of wild things going on. You're trying to have the camera positioned at eye level if possible, and it's stable. It's on a stand, so if you if I bump my laptop right now, it's not going to move my camera because it is on a separate stand. But also just lighting too is really important. People either look like a little shadow or a silhouette of themselves, or they look like they are being lit on fire or something. So it's very important that you try to position yourself in a way where it looks pleasing. You're not thinking about, wow, I can't I can't tell, you know, what somebody's looking like. I can't tell what they're looking at. I can't tell if that's a smile or a frown because I'm just not, the lighting is really dark. So avoid really, really bright lights behind you. I think that's just that's a trick for taking pictures as well. Video is just a live picture. So things that you've learned when you're taking pictures are very relevant to your video presence as well. Making sure that you can avoid a lot of noise going on at the beginning of this presentation. I'm at my home right now. I was at my clinic. It's rather noisy there right now because we're doing a lot of flu shots. So there is random screaming going on. So I felt as though if I came home, there would be less noise here right now for this presentation. But as I was pulling up my slides, the neighbors started mowing their lawn. So wherever you feel like that you can have that interaction with a patient where the noise is down to a minimum. And then as you can see, I'm a gestury person, so I'm not doing this because it says this, but in video presence, it's often recommended to be a little bit more extravagant, I guess, with your gestures and your nonverbal cues, because sometimes it's very hard to see every facial expression and the ways that you're interacting non-verbally. So being a little bit more expressive is really helpful. And looking into the camera is very important versus looking at yourself. So here I could continue the presentation where I am looking at myself here. I don't really enjoy that at all, but I'm giving you kind of an idea of what it looks like then to the family or to the patient, is that you're not really paying attention to them. So making sure that you're looking into your camera and not into your reflection, because once you look over to your reflection, your eyes shift to where they were before. Let's see. Audio presence. A lot of people feel like they have, and when they're on a cell phone, I don't know what it is, but when you're on a cell phone or you're speaking into a walkie-talkie or on telehealth, we feel like we have to raise our voice. If we have to raise our voice, then we probably should turn up our microphone a little bit. Speaking in a normal voice is so much better than feeling like you have to raise your voice in order to get your message across. So we kind of talked about this before too. It can be hard sometimes to hear. There's an audio, sometimes there's not an audio connection that works really well. So the one thing that you don't want is your email providing notifications over and over again. If you're on your phone, which some people need to utilize, there's making sure the function is turned off where it mutes your video and your audio when a call is coming in, because even if you have it set to mute, it still mutes you for a minute when it's ringing. Keeping paper and objects away from the microphone. Although rustling of papers doesn't sound very loud, if that paper is right next to the microphone, it can be a deafening sound. So making sure that the objects are away from microphone. And right as you start the session, confirming the audio of the patient. Can you hear me okay? Make that a part of just your standard practice when you start a session with a family. And then we have just our general session checklist here. These are some things to consider. Again, this is kind of an overview. You want to be more specific for your own sessions, but this can really help you guide you, especially during a task that may, with telehealth, that you don't have as much experience with. We have in-person experience, and we probably utilized some sort of checklist when we were learning how to provide in-person care. But for telehealth, this is sometimes a new modality. So having a checklist can be really helpful. So did I greet the patient when we started, and did we confirm the patient's location? And this comes back to some patients are in their car. You really want to know where they are for emergency purposes and to document in your note where they're at. Because if you get disconnected and you are concerned about them, then you can make sure that there are safety procedures in place to locate your patient. So you want to confirm contact information that was received at the time of the appointment, so that you can look through and ensure that, hey, and confirm, hey, if we're disconnected, I'm going to call you at this number. here's how many times I'm going to attempt to call you, and then if we're not able to connect, we'll have to reschedule. So having some of those, not just the contact information, but what happens if you don't answer. Here's, here are our procedures. And then reviewing who is going to be involved in the session. Like I said, sometimes I see the uncle staying for the next month and just walk across the back of the screen while we're talking about some private information. So we want to discuss what to do if we do see another individual enter the room. Sometimes it's nice to come up with a code word with a patient, especially if there is some sensitive information they would not like to share, so that all of this is thought about ahead of time instead of getting to that point where everybody's like, I don't know what to do. And then ensuring you're closing your link at the end of the session. Just because you're done with the session doesn't mean your patient has shut down their session. So I like to close my link entirely and reopen it for the next patient. One of the things that you might want to consider too is the age of the patient. Obviously, when we're seeing very young children or we're seeing adults, we might want to enter that relationship differently, even if we're in person. So in telehealth, it's not any different. So there's evidence for telehealth across the age range, but the considerations may be just a little bit different depending on the age of your clients. One of the things to think about with children is that children do not like to talk on the phone. So using telephonic with children can be kind of challenging. We hear this a lot. We've learned these lessons I've learned them primarily from families who are separated or have divorced parents, is that one parent may be offended that the child didn't want to talk to them when they were visiting with the other parent. Kids don't really like to use the phone. That's just not how they think. That's not how they do things. That might be more effective for an older adult. But for kids, we don't expect that that's an effective way to communicate. Children do like video. But they also may prefer less formal sessions. So making sure we're relating to them on their level and in their developmental, at their developmental level. So kids need space to move. They may need shorter sessions to make it effective. And we may need to do some extra planning for misbehavior, planning for when a parent maybe needs to go check on their children. Making a plan for that at the beginning. It is okay for you to go check on your children. I don't want you to wait till they're screaming. If you want to go provide them with positive feedback while we're talking, please get up at any time and do so. And then more interactive tools. There are some apps really cool apps out there, but oftentimes Zoom and other applications come with a whiteboard, some way to interact. They like interactive technology. Excuse me. Like I said, requiring a little bit more enthusiasm, and it might be required to engage children, ensuring that they have some toys and books, same types of materials they would have if they were in session with us. So that might be part of the appointment process. Make sure you have some nonviolent toys available to your child during our session. And then making sure that when you're talking with adolescents and teens, that you're providing them with a private space. I was meeting with a teen whose uncle did walk across the back of the session while she was disclosing some very private information. So making sure that we know what to do if somebody that we didn't intend to be in the session arrives. So I gave you an overview of some of the things to consider and how to keep individuals engaged and how to keep the procedures going. I invite you to look at some of what we've already done too. There's some telehealth webinar series that we have through our MHTTC. I have it listed here. If you, like I said, you'll get a copy of these slides and you can reference. We've gone through telehealth basics, billing, interactive tools and telehealth with children and adolescents and that sort of thing. We also have a number of resources that are dedicated to the response of COVID-19 on a variety of topics. We also have a racial equality and cultural diversity series coming up starting at the end of this month. That's a part of our Primary Care Coming Home series as well. But at this point, I'd really like to open up for any questions that you have, any topics that you would like to discuss. Stop sharing my screen now. Well, Michaela, I'm not hearing you right now.
Okay, so we have a question that came in through the chat, and it says, I have trouble balancing looking at a camera versus looking at a client on the screen. What would you recommend?
I think what would be helpful, this is, I think it is really hard because once you turn your head, you can't really tell where you were looking before. But I've done a few things. I have actually, this is where it might be helpful to send a link to your spouse or friend or somebody or colleague where you can say, where am I looking when I'm sitting here? And when I go to my clinic, I don't have the same webcam. So I'm looking at my laptop, which is down here right now. And where I have to look is very different depending on where I'm at. But a good rule of thumb is to continue looking into your camera. Right now, I am looking into my camera. Right now, I'm looking into on my screen, and you probably saw my eyes kind of wavering up and down. I'm trying to limit that, but you would really see it if I was looking down here at my laptop or my second screen, which is over here. This is me looking into the camera. This is me looking into looking at Michaela right now on the video chat. So looking into the camera, you're not always going to see yourself or the patient at all times, but when you're talking or you're interacting or you're observing, it's really important to keep that eye contact, because looking into the camera is usually best. But you can also do some selfies, take some pictures, ask your colleagues, where are my eyes at right now? That's really helpful.
Okay, Angie, if you want to ask your question, you can. Okay, so, yep.
I didn't have one.
Okay, sounds good. We have another question on here that says, how often is it necessary to get consent?
So that's a very good question. As a rule of thumb, we should always get consent for our services in some way, shape, or form. I would consult your state guidance, and at the end of this, you will. There are some websites, and if it's not clear, I tried to in the reference section give you some links to click, but it will take you to your state and offer some guidance there. For example, right now during the public health emergency, which is what the state of Nebraska calls it, verbal consent is appropriate for delivering care via telehealth. So you still get consent, but you may not have the patient sign for it. You may be receiving verbal consent. What we have found is that we tend to send our consent form prior to the session to the families, and we rarely get it back. So since we've been doing more telehealth now for initial appointments, it's much more of a concern. But the state of Nebraska allows verbal consent right now, and I think a lot of states are following suit. But I would just check with the laws in your state, and you can link to those pretty easily through a website.
Okay, and
not
then
always through your own state organization, but.
And there's a follow-up question with that as well. Does it need to be for each session?
So no, I always try to think about telehealth as just regular care, right? We're going to bill the same session, but we're going to bill the same way as we do an individual session, a family therapy or an individual therapy. We're just going to add a GT code on the end. So if you think about the way that you practice in person, it's the same as how you would practice via telehealth. There isn't something new that you should feel like you have to do every time, unless that is something you would typically do in an in-person visit.
Great. Okay, so it looks like we have a question that says, when I use my laptop, I make the client image smaller and place it right underneath the camera. So when I look at it, I'm still almost looking directly into the camera. Yes. Which I guess is more of a comment.
Yeah, but yes, and that's really helpful. So right now I'm moving Michaela right below my camera here. So usually you don't have a PowerPoint that you're sharing with families. So it is really nice to be able to make them smaller. Also, when you make a screen smaller and you become smaller, it is good to be able to see yourself. Some people use the function where just one person at a time, whoever's talking. I always like to be able to have access to what I'm looking like, because I'm looking right next to Michaela. Here I am, but now I'm looking at Michaela. I think it's really important to just be aware of what you look like every once in a while. I mean, do you have a nasty look on your face as you're thinking? What are you in the frame? Where are you at? Did things need to shift and move? So being aware of your presence, but not staring at your presence, is really important. But making it smaller can also help direct your eyes to a much smaller region, and ensuring that the patient feels like you're looking at them.
Okay, we had another question that came in that said, how do you talk to helicopter parents about privacy in sessions with teens?
Well, the same as so I always go back to this, and I say this because I really do mean it. The same as what you would do in an in-person session. I mean, I've had parents ask them to wait out in the waiting room. Now our waiting room is going back to your car, so I try to find another room for the family. But I think it's really important that you know that anybody could be listening, and I've had parents standing at the door in my session room, and you can see their shadow, and they're literally listening in. So I think it is really important to provide that information, and then to also ask the teenager or the teen or the adolescent, do you feel like that you are in a private location too? So sometimes just educating families that we will let you know if there's something very important to a message to deliver to you regarding your child.
Okay, and then Anna, do you have a question?
No, I don't. Can you hear me?
Okay. Yes, we can hear you. Yep.
Okay, no, I'm just learning. It was good today.
Good deal. Well, I'm happy to provide additional assistance. Like I said, sometimes this assistance can be helpful in your specific organization or with your specific profession, because we're not all working with children, we're not all working with older adults, we're all not on our own, hanging up our own shingle, doing this on our own. We're within an organization, and sometimes we have to utilize a certain platform or a certain consent form. But having you feel like you can connect yourself with state regulations, with current state regulations, connecting yourself with insurance, with the ability to see families via telehealth. And most insurance companies have lightened up, at least through the end of the year at this point. Some are tightening up or talking about it, but there's definitely been more access, I guess, from an insurance standpoint, and across state lines as well. So Nebraska is typically a state where you cannot practice across state lines without a special license, but right now they have removed that stipulation during the public health emergency. So you can see individuals in North Dakota, Missouri, anywhere in the U.S.
Okay, and if we don't have any other questions, it looks like it's after that hour mark. And we thank you very much, Holly, for coming and talking. And I will be sending out a post-evaluation survey for us, as well as a post-evaluation that will go with Holly over there. And it will have a link to the various webinar materials, including the archived webinar and Holly's slides as well. So thank you everyone for attending, and we will see you next week.
Thank you.